Hello and welcome to a Health Podyssey. I'm your host, Alan Weil. Among the many effects of the COVID-19 pandemic was the rapid and dramatic shift in clinical care from in-person to virtual. Telehealth, once a really minuscule slice of how care was delivered, came into the mainstream. And a variety of policies were put into place that eliminated historical barriers to using telehealth. The health system quickly adapted. But adoption and use of telehealth was not uniform. Much has been written about which patients use telehealth, but there's been less analysis of which providers use telehealth. So what do we know about the relationship between provider characteristics and their use of telehealth? That's the topic of today's episode of A Health Podyssey. I'm here with Jiani Yu, Assistant Professor of Population Health Sciences at the Weill Cornell Medical College. Dr. Yu and co-authors published a paper in the September 2024 issue of Health Affairs that looked at the differences in telehealth use by physician and practice characteristics. Some of the differences were quite large, and I'll just say some of them surprised me. We'll discuss them in today's episode. Dr. Yu, welcome to the program.
Thank you so much for the introduction. Excited to be here.
I'm really happy to have you as my guest. Remind us again, I think we all kind of remember when telehealth sort of took off as the pandemic took hold and we couldn't go to doctors' offices. Can you just give our listeners a little context here? How much did it increase, and did it stay with us, or did everyone stop using it when they could go back to the doctor's office? Just provide us a little context for the data that you analyzed.
Sure. So the use of telehealth, even prior to the pandemic, was slowly growing. And then, of course, the pandemic drove a dramatic expansion of telehealth coverage and utilization, followed by a decline. So during that initial rapid acceleration of telehealth use in the second quarter of 2020, data from CMS shows that over 47% of traditional Medicare beneficiaries use telehealth. So this was a peak of Medicare telehealth use. By the end of 2020, we saw that less than 30% of Medicare beneficiaries were using telehealth. And from 2020 on, telehealth use has continued to decline, although that rate of decline has significantly slowed in recent years, and it appears to have stabilized in recent years. So in 2022, about 15% of Medicare beneficiaries utilized telehealth, and that percentage has dropped only slightly to 13% in 2023.
So that's super helpful because your analysis is of 2022 Medicare fee-for-service data. So what you're telling me is this doesn't reflect sort of the spike, and it is pretty close to where we've stabilized. So it's a pretty good marker of sort of what we would expect to see in a steady state. I know that's not perfect, but that's sort of how I think about it, given what you said.
Absolutely. One thing I will note is that although the percentage of telehealth delivered office visits have declined from 2020 to 2022, but has achieved that steady state in recent years, the percentage of behavioral health services delivered via telehealth has markedly increased over the same time period. So all this is to say, while telehealth has not by any means eclipsed traditional in-person care, it has carved out a steady role in healthcare delivery for Medicare beneficiaries.
Well, that seems like the right way to think about this and why it's important to understand who is using it. So again, you focused on physician and physician practice characteristics. I'm just going to ask you to sort of walk through the findings by the various dimensions that you looked at. If I missed any, feel free to add them. But I know, at the beginning you were looking at the sex of the clinician and their age. And what did you see in terms of patterns?
Sure, we did find certain patterns of telehealth provision when we looked by the sex of the physician and the age category of the physician. Just looking very descriptively at our 2022 Medicare claims data, we saw that compared to younger male physicians, so those that are under the age of 39, older female physicians in the age category 66 or older provided nearly twice the share of the most common types of office visits via telehealth. So just to ground us with some numbers, younger male physicians delivered about 6% of office visits via telehealth, while older female physicians delivered around 13% of their office visits via telehealth.
Now, you do note in the paper that although there is that ratio, that the actual number of female physicians in that age category is fairly small. Am I right about that?
That's correct. Yes.
So we see these differences, but if we want to look at sort of overall use, we have to keep in mind that, of course, the age and sex distribution of physicians is not equal across all of these categories. Let's turn to another dimension you examined. You already mentioned behavioral health, but you looked at physician specialty. And here it might also be helpful to remind our listeners of what services you were looking at, because that, of course, is tied to what you see by specialty.
Yeah, so we show that in our data, although around 7% of the most common types of office visits, these are evaluation and management visits that we focused on, although around 7% of these visits were delivered via telehealth across all physicians, there is a lot of variation in telehealth provision, as you may expect, across physician specialties. So we looked specifically at psychiatrists versus primary care physicians, obstetricians and gynecologists, as well as physicians in other medical specialties and surgical and hospital specialties. So starting with psychiatrists, we found that in 2022, telehealth was used to deliver care in over 45% of the most common types of office visits. When we looked at primary care physicians, telehealth was used to deliver care in about 7% of office visits. For all other specialties, relatively higher percentages of physicians were delivering one or more telehealth visits in endocrinology, hematology, oncology, and rheumatology. And then, given the emergence of newer telehealth offerings and newer models of telehealth provision, everything from primarily in-person to fully virtual care models, there's a great framework outlined in a previous paper by Tang and co-authors in 2022. We also just wanted to provide an examination of telehealth provision beyond just averages. Is what we found when we examined the percentage of physicians across deciles of telehealth provision. For primary care physicians, more than 3/4, provided less than 10% of their office visits via telehealth, and less than 1% provided nearly all of their services via telehealth. So contrast that with psychiatrists. About a fifth of psychiatrists in our data provided nearly all, over 90% of their visits via telehealth.
So what you're reminding us is that you can sort of count the share of physicians who are using telehealth, but then beneath that, there could be very high use or very low use, and we need to understand that dimension as well. And you've done that. That's terrific. So another dimension you looked at was geography. And as I recall, there was both sort of the region of the country, but also urban, rural. Say a little more about what the differences were there.
Yeah, so in general, we found that physicians practicing in metropolitan areas delivered a higher share of their office visits via telehealth compared to physicians that are practicing in rural areas. We're looking at a difference of about 8 to 5% of office visits provided via telehealth in urban versus rural areas. And this rural-urban difference in telehealth provision we found was consistent when we looked at primary care physicians and psychiatrists. Because these rural areas are already disproportionately likely to have physician shortages, our findings do suggest that telehealth may not have meaningfully changed this dynamic, nor necessarily improved access to care for rural patients.
Yeah, that's really notable. I mean, if you go before the pandemic, a lot of the discussion about telehealth was as an access expansion for people with geographic barriers to receiving care. And so that's particularly notable. And just a region of the country as well?
Yeah, we also looked to see if there were certain patterns of telehealth provision across states. What we found is that in general, for primary care physicians, higher telehealth rates were concentrated in the Northeast and on the West Coast of the country. In general, there was actually more variation in telehealth provision across states for psychiatrists. We really didn't find any very clear regional patterns in terms of high telehealth provision for psychiatrists. We did find that for psychiatrists and primary care physicians, some of the Great Plains states and southern states had the lowest rates of telehealth.
And then you also looked at the characteristics of the patients these clinicians are serving. Can you say a little bit about what you found there?
Yeah, so we examined the characteristics of patients that were cared for by physicians delivering a higher versus a lower share of their office visits via telehealth. And specifically, we looked at patient race, we looked at dual eligibility status, and we looked at medical complexity. We found that among primary care physicians, as the decile of telehealth provision increased, these providers tended to care for a larger proportion of patients that were medically complex. They also tended to have more patients who are Black, more patients who are Hispanic, and more dually eligible patients. So in essence, higher telehealth primary care physicians tended to serve more medically and socially complex patients. We didn't see these patterns, however, among psychiatrists. So psychiatrists delivering more telehealth actually tended to care for lower percentages of patients that are dually eligible, that are Black, and that are medically complex. I do want to emphasize here, though, that these findings don't tell us whether this means that more socially and or medically complex patients are more likely to seek high telehealth or primarily telehealth physicians, or whether they are more likely to gain access to care vis-a-vis these high telehealth providers. But we're hoping that by highlighting these diverging patterns by specialty, this lays the groundwork for maybe some future work to examine how increasingly virtual care providers may exacerbate or mitigate existing disparities in access to care for these more vulnerable patient populations.
Okay, so we've covered a lot of ground here, a lot of numbers, a lot of data, and some interesting differences. I want to talk to you now about sort of what we do with this, why it's important, and how we make sense of it. We'll cover those topics after we take a short break. And we're back. I'm speaking with Jiani Yu about the use of telehealth by physicians and how it differs depending on various physician characteristics and practice characteristics. So thus far, we've thrown out a lot of numbers, and they're really interesting. And now I'd like to sort of turn to why this is important work and what to do with it. So this is descriptive, of course, but descriptive data are often the starting point for deeper analysis. Let me just start with sort of a broad question, which is, why does this matter? I mean, if you've looked at physician characteristics, you see varying rates, why is it important to know this?
Absolutely. So we set out to do this study in order to understand, now that we are in this steady state of telehealth provision, who are the physicians and by extension the patients that they care for who would be most impacted by the potentially forthcoming changes in Medicare telehealth policy. So if a lot of these telehealth flexibilities are rolled back, as is looming, firstly, who will be affected on the workforce side, and secondly, who will be affected on the patient side. So on the workforce side, we want to know which are the subgroups of physicians who may be more reliant on telehealth, including for job satisfaction and for reimbursement. And on the patient side, because telemedicine use is a function of both patient demand and physician supply of telehealth, understanding who the providers of telehealth are helps us to understand whether certain groups of patients will continue to maintain their access to telemedicine. So ultimately, policymakers deciding on telehealth coverage and reimbursement could benefit from a deeper understanding of the proportion and the types of physicians and patients who stand to be most impacted by potential policy changes.
So let me just take that a little farther. I really like that answer. We've published a lot, and people have really tried to analyze the cost side of this. Medicare loosens the rules. There's a lot of concern that there will be increased demand and increased cost for the program, and that money drives a lot of policy in healthcare as in everything else. And what I hear you saying is, there's another dimension here, which is not just what does it cost or what would be saved or lost in terms of the dollars, but that it will actually affect patterns of who's delivering care and who's receiving care. And we need to be thinking about that as well as we, as policymakers, need to be thinking about that as well as they're trying to figure out whether or not to extend these rules. Is that a fair way to think about it?
Yeah, absolutely.
With that in mind, you already alluded to the fact that we were in debates about extending some of the policies that make it easier to provide telehealth. Given your broader knowledge, not just this paper, although I love talking to you about this paper, if you're sitting in front of Congress and they ask you, Dr. Yu, should we be extending these provisions? I know that's an unfair question to ask. You'd have weeks to prepare your testimony, and I'm just asking you on the fly. But what do you think? What would you say?
Yeah, so just to set the stage a bit, at the end of 2024, so many of the Medicare telehealth flexibilities that were put into place during the public health emergency will end. So that includes, Medicare beneficiaries being able to receive non-behavioral health, non-mental health telehealth services in their own homes and in non-rural areas. That also includes the reimbursement of many non-behavioral health, non-mental health audio services. And so while telehealth was permanently expanded for those behavioral and mental health services in 2020, the legislation to extend telehealth flexibilities for all other services beyond the current end of 2024 expiration date has not yet been passed. And so my understanding is that a major concern of policymakers is that this longer term expansion of telemedicine will increase healthcare spending and or decrease quality of care for patients. So what we know from just our paper is that telehealth still represents a sizable portion of healthcare services provided by primary care physicians and other physicians, not just those specializing in behavioral health. And then from another recently published paper, also from our team, we found that audio visits still make up a quarter of all telehealth visits in 2022. So therefore, patients, particularly those who are socially and or medically complex, are still heavily reliant on audio-only delivered care. So building on these findings, in order to inform Congress, we're at a juncture where it is critically important to examine the impacts of these temporary telehealth expansion. We're at a point now where newer Medicare claims outside those initial, turbulent 2 years of the pandemic are becoming available for analysis. And our team is currently working on research using this data. So we're trying to understand whether patients who have higher access to telehealth have different outcomes in terms of healthcare utilization, in terms of emergency department visits, hospitalizations, and healthcare spending compared to patients that have lower access to telehealth. And we're particularly interested in understanding the extent to which telehealth offsets or substitutes in-person care. So we hope that this forthcoming research will contribute to a growing body of evidence, some of which has already been published in Health Affairs, using this nationally representative Medicare data about the impacts of extending these non-behavioral telehealth flexibilities for beneficiaries. And so it's the interpretation of these findings, including potential increases in healthcare spending, but also potential improvements in access to care that will help us determine the extent to which telemedicine will remain a more permanent fixture in the U.S. healthcare system.
Well, you must have been looking at my notes because I was going to ask you what comes next in your research, and you basically answered that without me asking you. I think what I'm hearing you say is that beyond the descriptive work that's here, that's very valuable, there are questions particularly about the relationship between the use of telehealth to the outcomes that we care about. And this is not fair to mention because it hasn't been released yet as we're recording this, but I just had a conversation with another author about coverage of anti-obesity drugs. And what we often are faced with is that even if the cost is higher, there probably are health benefits. And I think what I'm hearing you say is that we need a better read on the cost, but also on the health implications and the access implications and the access distributional implications for high need populations. And you sort of put that all together. It doesn't answer the question of whether you should extend it or not, but it gives you a much clearer understanding of what the implications would be of either extending or not. And your team is hard at work trying to provide that evidence. Did I get that about right?
Yeah, I very much agree with that, Alan.
Wonderful. Well, Dr. Yu, it's been great to talk to you. Thank you for doing the work and explaining it so clearly to our listeners. Thanks for being my guest today on A Health Podyssey.
Thank you so much for this opportunity to share our work.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about A Health Podyssey.